The best way to test a vaccine is to give it to an army of volunteers and see how many go on to catch the virus.
So Lisa, you've literally just had the vaccine. Why have you got involved? I mean, you work on intensive care, don't you, as a nurse?
Yeah, that's right. I think just seeing firsthand the devastation that COVID has caused, really it was a no-brainer for me. I felt like I had to.
What have the last few weeks been like?
Devastating for the patients and more so for the families who haven't been able to be there by their relatives' side through some horrendous weeks.
It normally takes months to set up a big trial like this. A volunteer every 15 minutes on a conveyor belt of tests and checks before they're given either the experimental new vaccine or another control vaccine. They aren't told which.
So none of this would have happened without Jo, who's the head nurse here. She's organised us absolutely meticulously for the last 4 weeks.
So Jo, you're the boss,
Yes.
basically. Well, how complex has this been?
This has been a very complex thing to organise because we're trying to get through a lot of people in a short period of time for the screening and for the vaccination, and we're also working together with 3 hospitals, so there's 3 different sets of nurses that have worked together, and it's all gone amazingly well.
Across Britain, 10,000 volunteers will trial this Oxford University vaccine, including 500 in old rival Cambridge. They're all frontline health workers because they need people who are regularly exposed to the virus.
Well, I'm a doctor here and I've seen what COVID does. I'm just fed up with it. I want to do all I can to get rid of it.
Of course, what people want to know always is when might you have some results? When might you know if it's going to work or not?
Well, I think Oxford have been saying that they would hope to have some results or some preliminary results by the autumn or by Christmas of this year. And certainly at the moment, as you're aware, vaccination production is being scaled up massively, so that if the trial is shown to be beneficial, they'll be able to roll out vaccinations very speedily.
There are no guarantees that this vaccine will work, but the research is being fast-tracked because everyone hopes it's a way out of this crisis. Richard Westcott, BBC News, Cambridge.